conditions cannot be denied coverage. Here's a poll that shows 85% of all people in the country approve of that provision, just 12% disapprove. An estimated half of all Americans can be considered to have a pre-existing condition. And if Republicans have their way and are able to repeal the health law, GOP lawmakers say a better way to get people insured is through state-run programs called high-risk pools. So what are they, and will they do the job? We're joined by Merrill Matthews, who's a resident scholar with the Institute for Policy Innovation, director of the Council for Affordable Health Insurance, and Jennifer Jaff is executive director for Advocacy for Patients with Chronic Illness. Nice to see you both. And Jennifer, let me start with you. Half of all Americans, and full disclosure, I'm one of them as someone with Crohn's disease who would be considered to have a pre-existing condition. But who are these people, and how are they traditionally treated by regular private insurance companies?
Well, pre-existing conditions are defined extremely broadly by insurance companies. You have a chronic illness, I have a chronic illness, but people who are taking an antidepressant have a pre-existing condition for insurance purposes. People who are on antibiotics at some point in the 6 months before they applied for insurance are considered to have pre-existing conditions. Roughly a third of the people who apply for insurance with a pre-existing condition are turned down. And for the most part, they have very few options. High-risk pools are certainly not a good option for most of them for several reasons, starting with the fact that you have to wait for 6 months before you can get into a high-risk pool. You have to go without insurance or without coverage of your pre-existing condition. In addition, high-risk pools are very, very expensive. I know Dr. Matthews has talked about the Minnesota high-risk pool, so I did a little research this morning, and it would cost me under the Minnesota high-risk pool $2,200 a month in premiums. That's not including deductibles, copays, and so on.
Merrill, let me jump in and talk to Dr. Merrill Matthews about this, because these are some concerns that people have. And conservatives certainly say they want to see people with these pre-existing conditions get coverage. They just think that a better way is these high-risk pools. So as you listen to what our other guest was saying, how do you answer those concerns? Why should someone with a pre-existing condition be forced to wait 6 months or a year to be covered for treatment of that, like cancer or medication for high blood pressure, that kind of thing?
Well, first let's get a size of the problem here. You've got roughly 90 million Americans in Medicare or Medicaid. They can have a medical condition, they get that coverage. You've got roughly 170 million Americans who get their health insurance through their employer. There may be a small waiting period, but if you're going into a group policy with employer, you'll get coverage. So what we're talking about is uninsured individuals with a medical condition who are wanting to go out and buy a policy on their own. And most insurance companies will check to see if there's some kind of pre-existing condition. If there's a major condition, they may put a waiting period, they may put a rider on there, they may charge them more, or they may decline coverage. And so 35 states have created these state-based nonprofit high-risk pools to provide coverage for those people who are uninsured with a medical condition. You've got 220,000 Americans in those pools. Jennifer is right, they do charge more. But one of the things that you could do to make these better is provide some federal funding for this safety net to make sure that those are affordable for low-income people and so forth, because they do charge more than a standard policy, but they still lose money at that because these are people with pre-existing conditions.
Jennifer, what do you say about that?
Well, these high-risk pools are already being subsidized by the states, so it's even at these very high premium prices, people's healthcare costs are not being covered. It makes far more sense to me to have insurance companies provide coverage for people with pre-existing conditions and have what's become known as the individual mandate to make sure that free riders, people who choose not to get insurance but could afford insurance, make sure that they pay into the system so that we, the taxpayers, are not stuck paying their bills when they end up in an emergency room but they're unable to pay.
Merrill, the idea of a mandate was originally a conservative idea, and the term free riders that Jennifer just used is the exact same term that then Massachusetts Governor Mitt Romney used in justifying the health care system that he put in place in the state of Massachusetts while he was there. Why the change of heart? Why have conservatives gone from being in support of an individual mandate in order to cover those with pre-existing conditions to now suddenly thinking that that's not the best way to go?
A quick correction, Rick. Some conservatives supported the individual mandate back during the Clinton health care reform debate, and after that, most did not. I was in the middle of that debate. 8 states during the 1990s passed a sort of a version of the Clinton health care plan, which required the insurance companies to accept anyone who applied in that individual market. And they did not include the mandate. Those premiums exploded, as Jennifer sort of alludes to. When you do that, you have people who decide they're just going to wait until they have a medical condition to get coverage, and so the pool gets very small, it gets very expensive, and so the mandate imposed in the healthcare legislation is an attempt to try to resolve that problem. But if the penalty isn't great and the penalty isn't large, you're still going to find a lot of people gaming the system. That goes on in Massachusetts right now, which has that individual mandate.
It's an important subject, and again, a bipartisan concern that people with pre-existing conditions be able to get access to affordable health care. So it's a story we'll continue to follow, and I hope you'll both come back on and talk to us more about it. Jennifer Jaff and Merrill Matthews, thank you, and happy 4th of July to you both.
Thank you, Rick.
Thank you.
Well, Rick, there is a new study raising